Labial adhesions. For the most recent updates on pediatric urology, refer to the Pediatric Board Study Guide 3rd edition. Labial adhesions, a very important cause of recurrent UTIs. If you have a female with recurrent UTIs and unexplained, very important to examine the genitalia. Like this girl, she almost doesn't have any opening. It was very hard to catheterize to obtain a urine sample. And the most common presentation of labial adhesions is asymptomatic, no symptoms. Also may present with urinary symptoms like vaginal symptom like pain, discharge, or infection, or UTI. Treatment of asymptomatic labial adhesions, reassurance, no treatment is required. Very important, high yield. If it's symptomatic, you can use topical estrogen cream twice daily for 14 days using cotton tipped applicator to avoid overuse or too much of the estrogen topically, because it will be absorbed. So using the cotton tipped applicator will decrease the side effect of topical estrogen. But still, we have to be familiar with the side effects. It may cause local irritation. It may increase the breast size and will cause breast budding, breast tenderness, bleeding, and vulvar hyperpigmentation. But all these symptoms will disappear once you discontinue the medicine. Teach the parents how to apply the medicine. First step, apply gentle traction to the outside, as you see here in the figure, to expose the line of adhesion. Then smear the cotton tipped applicator with a small amount of estradiol cream. Then apply gently on the line of adhesion as you see here. After finishing the 14 days with estradiol cream and the line of adhesion is already opened, apply Vaseline petroleum jelly for 1 to 2 months, at least 2 to 3 times a day to prevent re-adhesion. This is the end. Thank you.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review Series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.